Scotland's new GP-IT systems are currently being developed by our 3 framework suppliers, EMIS Health, Vision and Microtest. Once developed, the systems will be tested by national and local teams before being validated as approved Scottish Government systems that are available for use in Scotland. The NHS in Scotland must be fair and equitable in its dealings with its framework suppliers. Procurement rules dictate that selection of your new GP-IT system must be based on objective, need-based criteria and not just on personal preference. Due to the increasing need for collaborative working, it is highly recommended that general practices work together with their neighbouring practices when selecting their new GP-IT system. General practices are being asked to group themselves together into cohorts, and local NHS boards will support this cohort formation process. General practices will also need to describe the factors that are important to them, using the criteria and weightings specified in the new GP-IT framework contract. Once cohorts have been provisionally agreed, meetings will be held to discuss your requirements with other members of your cohort and translate these into objective scoring and evaluation criteria. Local NHS boards will facilitate and support this process. A pre-prepared menu of evaluation criteria will be available to help with this task. Cohorts will also be free to identify additional appropriate criteria, and procurement advisors will be on hand to assist with this activity. Where a number of cohorts are identified as having similar requirements, it may be beneficial to group these together to form fewer, larger cohorts. With agreement, NSS will facilitate and support this process. Once a cohort's membership and requirements have been defined and confirmed, the cohort will decide who its representative should be. This group of individuals will be known as the cohort's collective decision group and should include a mixture of different GP-IT system users, such as GPs, practice managers, practice administrators, nurses, pharmacists and other members of the multidisciplinary team. Accompanied by local NHS Board eHealth and finance staff, and local medical committee and health and social care partnership representatives. Suppliers will be invited to enter into mini competitions to demonstrate how they can meet a cohort's requirements. They will submit a written bid and provide demonstrations of their new approved systems. The collective decision group will then evaluate the mini competition tenders, applying the cohort's evaluation criteria to select the GP-IT system which best meets its needs. The cohort's winning supplier will be awarded a call-off contract with NHS National Services Scotland, and planning will commence to ensure the smoothest transition and minimal disruption possible for the practices in that cohort. GP-IT Scotland, providing modern, secure GP-IT systems that support the evolving models of care in Scotland.